The safety of our patients, families, employees, and each other is our most important priority. As an organization, we're committed to reducing preventable harm to our patients and employees and developing a strong culture of safety across Michigan Medicine as we're on our high reliability journey. In partnership with our leaders, I'm so excited to talk about our HRO Safety and Reliability Coach program. Our HRO Safety and Reliability Coaches are helping our organization drive habit formation and sustainment of those expected HRO behavior, skills, and tools, because we know changing behaviors is foundational to a safe, reliable, together culture.
I'm very passionate about high reliability and patient safety, and largely due to being a patient myself, having family members have been patients, and just in general, I've been caring for people for the last 17 years. And I know the impact that we can make on patients and patient outcomes and family outcomes. As a leader, I find being a patient safety coach very important. I like to lead by example, and it is very hard for people to want to correct somebody or tell them that they're doing something wrong. And so by me going out there and doing that and showing them that it doesn't have to be a painful process and that there's a respectful way to correct somebody. And ultimately, by doing that, we're helping to keep our patients safe.
I chose to be an HRO coach so that I could be in a position where I could support my colleagues in providing the safest possible environment for our patients and their families. I do think that, I see clinically, daily, probably our staff taking advantage of all the support that they have around them to be sure that they're providing the safest possible environment that they can for our patients, reaching out to one another and supporting one another in those regards.
The organization created the safety promise as well as leadership skills and universal skills to create a space for us all to utilize practices to help get us to that zero harm. Those practices, including the skills and the safety promise, should be work that's happening with everyone that works here within the organization as we are working together to influence the care that's provided here to our patients and being mindful of our employees and staff.
I read a lot of risk reports, and I'll tell you 9 times out of 10, the only difference between a serious patient harm event and a near miss is one person. One person speaking up for safety, taking that star moment, escalating up the chain of command. So if it only takes one person, it makes me think, how can we build and sustain a culture where every person, every time feels comfortable using these HRO skills to best protect our patients? And I think that's what our HRO coach program does. And I might be a little bit biased because I was an HRO coach, but honestly, that's where I fell in love with the science behind safety and reliability. And when you have those aha moments and you see the vision, you want to go back and you want to tell everyone about it. So what our coach program does is it takes frontline team members who are passionate about safety, and it helps them become experts in HRO skills, which are essentially evidence-based error prevention tools. And then it empowers them and supports them to go back and work with their local leaders to positively impact culture in their area.
Living out the safety promise here at Michigan Medicine in our cardiovascular department has been a huge improvement because it's helped staff feel comfortable to come to us with concerns, to know that there's no fault, it's only a learning process, and it's really built those relational skills that really help with communication. We're building a trust culture here by having that understanding and empathy between staff and leadership.
When anyone speaks up for safety, we always pause. So whether it's the local leader as myself or our HRO coach or MAs or physicians, we always stop and we pause and we look at the process. We never point fingers at the person, but we like to just say, how can we help support our team and what processes can we put in place to ensure it doesn't happen again and that the team feels supported with asking these questions and elevating these questions. So I truly believe the tools that Michigan Medicine has provided, along with just the collaboration with everyone, has helped us to create a more trusting culture and to ensure that patient safety is always number one.
Thank you for giving us your time so we can highlight our HRO Safety and Reliability Coach role and to say thank you for all that you do. We know safety is everyone's job. Everyone contributes to patient safety. Together, we can learn and act to create safer systems, safer habits for reliability, and safer care. To be a coach is to go above and beyond, to inspire and influence, to champion high reliability, and to share your passion for safety. Remember, if it's not safe, it's not care. So thank you for being a safety and reliability hero.